we are this afternoon with Dianne Sharp. Dianne, you're an ophthalmologist working in Auckland,
Yes.
and you're here talking about macular degeneration,
Yes.
and you've set up an organisation.
Macular degeneration in New Zealand.
There you go, it's nice
Yeah.
and simple.
Yes.
So what are the messages you're getting across here to general practitioners today?
My talk is that when straight lines become crooked, and the main reason I would want to talk today is to raise awareness for the early signs of something like macular degeneration. This is the leading cause of blindness in the over 50 age group, and 1 in 7 over the age of 50 are going to be affected in some way. So it's really important that you know what to do and how to recognise early signs. So one of the easiest tests of when straight lines become crooked is using the Macular grid. And so I'll be introducing people to the Macular grid, and we have a small one, we have a large one that they can hang up on their wall, and advising people how to use it.
See, this is interesting because often in surgeries you see the old-fashioned eye chart on the back of the door.
Yes.
But I've never seen this. Is
Yes.
this new, or?
I think a lot with, well, first of all, when somebody comes in with some vision problem, the first thing you do is measure their vision, so that's really important. But we didn't used to talk much about macular degeneration because we didn't used to have treatments, and that's the big change now because we've now got treatment options. So it's really important that the most severe form is picked up at an early stage because we can treat it, we can do something about it.
So this chart is just looking at lines that aren't straight. It's simple as that.
Yeah.
So is there a distance you need to be away?
So we've got a very large one.
Yes.
Very large one here, which we're giving it to GPs to put on their wall, and that raises some interest. That's to be about 1 metre away from that. But the little one that we have here is with their reading glasses on, or reading correction, and looking with each eye individually, looking at the little dot in the centre and making sure all the lines are straight. So that's at reading distance for that. And making sure each eye is tested individually. It's quite easy, and we are offering to supply GPs with a bundle of these so that they can hand them out to their patients. So people who are at risk with this, if you have a family history, you have a 50% chance of developing macular degeneration as well. So that's an easy question to ask if somebody has that family history. If they're a smoker, 4 times more likely to develop macular degeneration and 10 years earlier. So again, another really high risk factor. And of course, age.
Well, that was my next question, because most males, not after 50, they should be getting it's prostate. So there needs to be other things added to that.
That's right.
So
having your eyes tested.
That's right.
Yeah. And asking the 2 questions: do you have a family history? Are you a smoker? Because that puts you in a higher risk group. But having your eyes tested and seeing if you've got at-risk signs. So we know that there's about 1.5 million people in New Zealand who are in that at-risk group. And of those, we want to have early recognition, because the most severe form will develop very rapidly, and untreated 50% of people with that severe form, which is the wet macular degeneration, will progress to severe vision loss and legal blindness within 3 months.
So are there flags in medtech for a reminder for these things? Is there anything you can set up?
At the moment, I don't think there are any particular flags. I think it's really important that we do. That's what we're looking at, ways in which we can have that sort of mechanism in place.
Okay. Yeah. So, and as part of the diabetes check as well, this should be part of the check as well?
Well, that's also checking the back of the eye.
Yeah.
So that's another thing I'll be talking about here is diabetic macular edema, which also can cause straight lines to become crooked. And diabetic macular edema, it's important that is treated, because a similar sort of treatment is available for that. So with macular degeneration, the treatment really should be within weeks of symptoms. With diabetic macular edema, we have a little bit more time, and permanent changes would occur within months. So we need to be see a little bit.
So a conversation with a GP, with a patient with a family history, should be pre-warning them if you get signs of lines going wonky. What are the signs that patients would come and present with?
Yes, when straight lines become crooked, when there may be some blurring of their vision, some little patchiness in the vision, but really there are some early signs which are visible by an ophthalmologist or an optometrist, but not necessarily giving them any changes to their vision at all. So they need to have an eye test, and ideally people would, over the age of 50, would have an eye test, and they would be told whether they've got some early changes visible in their eyes.
Now, of course, having an eye test means money, so I imagine that people in high deciles it's not necessarily an issue, so people with low decile areas would present late and end up with more potential for blindness.
Look, I think the first thing is just that people are aware of it. We've done a galaxy poll and had a look at how many people even know that macular degeneration affects the eyes, and there's 41% of the over 50 population in New Zealand. 41% of our population do not know that macular degeneration can affect their eyes. So even if they had the earliest of changes, they don't even know. So awareness is really important.
Do you have an awareness week?
We have an awareness week. It's very, very difficult to reach people, and you have to just keep saying the message over and over and over. But I think it's taking it back to GPs too, that they have that conversation just among all the other things, just a quick chat, getting their history and handing out Amsler grids and advising people how to use those. We have Amsler grids. I've got a handy little magnet on the back that you should put on the fridge.
Yeah, great.
Yeah.
Dianne, you spoke about treatments. Tell me about what treatments are available for macular degeneration, because there used to be none.
There used to be none. Yes, now we have a treatment. It involves a little injection into the eye, which sounds fairly tough, but in fact, it's a bit like diabetes. We've now got turned a chronic disease into something that we can manage, and the outcomes of treatment are that 95% of people will have stable vision, and about 40% retain driving vision, and 30% actually achieve 3 lines of improvement in their vision. That's a huge difference from what happened before, that 50% of people would be legally blind. That's the alternative. So the treatments are there. The treatments need to be instigated at an early stage before you have scarring and before you have irreversible loss, and that's why the urgency of people knowing about this and having early treatment.
Dianne, good luck with the presentation tomorrow.
Thank you very much.
Thank you very much for today.